Dr. Panda, one of the things that, I think is always difficult as a pediatrician is handing off my families and my patients sometimes, for lack of a better term, right? I'm not the foremost authority on Duchenne, and I can freely admit that for sure. Um, and so, but I do want to be there for my families, right? I want to do the things from my office that I can. I want to continue to be, helpful in whatever capacity that I can without overstepping my boundaries. But what do you see as kind of the role in the pediatrician once this diagnosis has been made and once they're starting to follow with neurology for Duchenne specifically?
Sure, we don't want you to hand off your patients to us, right? We still want pediatricians to be involved, the primary care providers to be involved, right? But in the family's mind, it's like, hey, you are the specialist, you know about the Duchenne, you are an expert, right? And we go to the center, we want everything to be done by you here. So a flu vaccine, if they get a cough, if they get a cold, we get called first, right? And then I think it's a lot of it is going to be us educating the families that, hey, you still have to be in touch with your primary care, and they still have to do, what they're supposed to be doing in terms of your regular medical care, and also us communicating with the primary care providers.
Yeah.
It's actually, or it's kind of a standard practice that we have to do. Sending our notes, information about Duchenne, keeping our primary care providers up to date on what's going on about our patients. I think the communication is the key here with the families and also with the pediatricians. Um, I'm going to ask you the same question. Um, what role that you think pediatricians can or primary care providers can provide to these families?
Yeah, and I think you hit the nail on the head really, really well, and I'm so glad you said what you did because it is just so important for us to know what's going on with our families, right? And
Yes.
sometimes things fall through the cracks and the notes get put in the wrong place, or we don't see them, or they don't come through our fax machine because we're still on faxes for whatever reason for a lot of our stuff. But if you know that your kids are following up in a Duchenne clinic and you're seeing them 2 months after that follow up, you know, make sure that you've read those notes or you've reached out to their neurology team. It's just so important for these families that they see us as a team for them, right? That this is a
Yes.
team approach to
Hmm.
managing them. And so if they come into the office and don't feel like, I know that they've seen anybody or that I know that they've, started steroids or anything like that, then they feel like I'm disconnected from their this thing that is a huge part of their life.
Agree.
Um, and so if we can really look at them as pediatricians as this whole picture, if we can allow them to see that we are a medical team, and that you guys are managing and we're helping to kind of follow along, if we can even have some encouragement and say, hey, I'm so glad they started you on those steroids, that this is going to be so good for you guys, and be encouraging back and forth to each other with these families, I think they'll be able to see that we're all invested in everything, and that while their pediatrician may not be their specialist,
Right.
their pediatrician is not lost or devoid of the things that are going on with them. And I think that goes a really, really long way.
No, I completely agree. I think showing them that we are one team is the key. Then that automatically, make them trust you, and they can call you right away. You'll be the first point of contact before they call me.
For sure.
Yeah.
And I
Um,
do. I
um,
still want to see them for checkups, and I still want to see them for their flus, and I don't want them to go to you for those
Right.
things.
Yeah, exactly. And I think, a lot of the other ways that I could actually use the primary care providers also, a lot of times we do a lot of blood work on them,
Hmm.
as a standard of care, and when they come to see us, and let's say, for example, if their vitamin D is low, if they want to
Hmm.
recheck in a couple of months, hey, I can pick up a call, phone and call you. Hey, can you please follow up on that? A lot of these small, in between, testing and
Yeah.
little follow-ups that can be easily coordinated with primary care providers.
Yeah, and I think that's a great point too, Dr. Pan. We were talking especially about our rural families and our
Right.
people who may have to travel, 2, 3 hours to get to a Duchenne center. And so, hearing from the neurologist or seeing in the notes or hearing from family, hey, I need to follow up on a CK, I need to follow up on a vitamin D, I need to follow up on something from that lab work. And that's something we can draw in office and provide for families. And then we can get it sent over to you guys. We can fax it, forward it, email it. so that our families can at least continue to do things close to home,
Right.
or not have to travel all the way to whatever their closest Duchenne center is, if it's more convenient to be there with your PCP, or if you're there doing checkup stuff anyways.
Yeah, it all goes back to that closed loop communication and,
Yeah.
showing them that we are a team.
And I think it's really important too for us as pediatricians and primary care providers to be able to sit down and have some of these conversations with families too, to let them know that we're going to be part of a team, to let them know that we're going to be there for them. And so one of the things I always try and do with families is just sit down and say, hey, this is going to be a long road, right? This is not something that we're changing overnight or we're fixing overnight. Um, but you've got a fantastic team behind you right now. The Duchenne team that you're seeing is going to take awesome care of you, and we're going to work close alongside them to get you guys the things that you need, and to be there for you every step of the way. And you may come in here and you may ask me questions that I won't have the answer to, but you can know that if I don't have the answer to it, we're going to pick up the phone and we're going to find it, because you've got a team on both sides that's going to work together with you, and we're going to do every single little piece that we can to continue this journey, and to walk alongside you guys in this, because it's not going to be a short-term thing, but you've got a great team around you to help you walk through it.